Is your thyroid medication causing osteoporosis? And I've read this research, and there are some things that I think you need to be aware of. A lot of this talk about levothyroxine causing osteoporosis is stemming from a press release, a news release of a clinical study that was presented at a meeting of the North American Radiology Association. First thing you need to know, presented studies are not the same thing necessarily as peer-reviewed studies. From what I can tell, this paper has not gone through the peer-reviewed process. That said, let's talk about the findings of this study. The study involved 81 healthy people in their 70s who were taking hypothyroid medicine, but yet did not have hypothyroidism. And they compared them to 364 people of the same age group who were not taking levothyroxine. Here's the main result to get everybody's attention. Let me quote these researchers. The results showed that levothyroxine was associated with greater loss of total bone mass and bone density, even in people whose TSH levels were within the normal range when they were followed for up to 6 years. Sounds pretty scary, but here's the part I think a lot of people missed. These researchers were concerned that some people were taking levothyroxine even when they did not have hypothyroidism. And from their research, they're showing that levothyroxine is associated with bone loss, but association does not necessarily mean it causes bone loss. But here's the other thing. They are not necessarily saying that levothyroxine causes bone loss and osteoporosis in people who have hypothyroidism. Notice the difference. They're saying that levothyroxine is associated with bone loss in people who have normal functioning thyroid glands, but who were, for whatever reason, prescribed levothyroxine. That's very different than people who are prescribed levothyroxine for their hypothyroidism. And I think that's an important distinction to make, because I think some people with hypothyroidism are going to see this study and are going to be afraid to take their levothyroxine out of a fear that it might cause them to get osteoporosis. That doesn't appear to be what these researchers are saying. So I'm not a doctor, I'm just interpreting this research for you. I think the take-home message here is if you have hypothyroidism and you were prescribed levothyroxine, keep taking it, and definitely talk about this research with your doctor and see what they have to say about it. And if you do not have hypothyroidism and you were prescribed levothyroxine in the past, absolutely talk to your doctor about that too.